Hello, my name is Elyse Huwe, and today I will be discussing implementing HIV education programs in South Africa. HIV stands for Human Immunodeficiency Virus. HIV damages immune systems and interferes with the body's ability to fight the organisms that cause disease. HIV is transmitted sexually, but can also be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. There is no cure for HIV, but there are medications which can suppress the virus and slow the progression of the disease. HIV affects 6,300,000 people in South Africa, mainly those who are 15 years of age and older. In 2013, there were 200,000 deaths due to AIDS. After the end of the apartheid in South Africa, public places became desegregated. This allowed for a more rapid spread of the HIV infection since new individuals were coming into contact with each other. The statistic climbed from 0.7%. This brought together healthcare workers who organized the National AIDS Coordinating Committee of South Africa, or the NACOSA, in 1992. In 1998, a breakthrough was finally reached and South Africa began to provide HIV-positive pregnant mothers with antiretrovirus drugs. This lowered the number of babies being born with HIV every year. Unfortunately, even now there is a conflict between the President of South Africa and the scientific community. The current South African president, Jacob Zuma, believes that the antiretrovirus, ARV, treatments are toxic, and he has informed his country of his beliefs. Therefore, parts of South Africa still believe in a holistic medicine approach when it comes to HIV. This includes treatments such as a balanced diet, lemons, beetroots, and garlic. As stated earlier, HIV is spread by sexual contact, bodily fluids, and can also be spread through breastfeeding from mother to child. The virus attacks the body's white blood cells, specifically the CD4 count. Depletion of the body's white blood cells allows for opportunistic infections to take advantage of a weakened immune system. This can allow other illnesses to destroy the body. An individual normally has anywhere from 600 to 1,500 CD cells in their body. Once this number drops below 200, the individual is considered to have acquired immunodeficiency syndrome, or AIDS. An individual is generally susceptible to AIDS if they are sexually active and do not use proper protection. In addition, an individual who participates in risky behaviors, such as having many sexual partners and sharing needles, may increase their chance of contracting AIDS. HIV can be detected by signs and symptoms. Typically, an individual with HIV will experience symptoms such as fever, headache, chills, rashes, sore throat, mouth or genital ulcers, swollen lymph glands, joint pain, night sweats, and/or diarrhea. In the first month to month and a half, an individual can expect to experience flu-like symptoms such as those listed. This is known as primary HIV. After a period of 3 weeks to a month, these symptoms may cease. Those with chronic HIV, which is 8 to 10 years after initial infection, may experience weight loss, cough, and shortness of breath. If HIV is left untreated, an individual can expect to have progressed to AIDS after about 10 years. The symptoms associated with AIDS include soaking night sweats, fever higher than 100 degrees Fahrenheit, cough, shortness of breath, diarrhea, persistent white spots or unusual lesions on their tongue or in their mouth, headaches, persistent fatigue, blurred vision, weight loss, and skin rashes or bumps. If HIV is left untreated, it will develop into AIDS, and those individuals with AIDS have a shorter life expectancy. They can die of a mild infection such as a cold due to their weakened immune system. Men who have sex with men are not only disproportionately affected by HIV, but the men who have sex with men behavior contributes significantly to sustaining the high number of new infections recorded each year. Estimates of HIV prevalence vary from 10.4 to 47.2%, according to location and sampling methods. Being an individual of homosexual orientation still has a stigma largely attached to it in South Africa. For these reasons, men who have sex with men may be disproportionately affected because they do not feel comfortable with being tested or receiving treatment. There is no cure for HIV/AIDS. However, there is a treatment offered. The treatment requires an individual to take multiple antiretroviral pills every day for the rest of their life. These pills suppress the virus, allowing the CD4 count to stay at a sustainable level. An individual should start ARV treatment as soon as they find out that they are HIV positive. However, the side effects include nausea, vomiting, or diarrhea, heart disease, weakened bones, shortness of breath, skin rashes, and bone death. Prevention strategies. South Africa is currently working on a campaign known as 90-90-90. It starts with testing. 90% of those with HIV become aware that they have HIV. From there, 90% of those who are aware of their status begin treatment. The last 90 stands for 90% of those individuals on treatment to successfully suppress the HIV virus. Primary prevention strategies for HIV include education. This involves teaching individuals and communities about the importance of protection during sexual intercourse. This can also require education on family planning and programs that have been successful in lowering STI rates in communities. In addition to education on sexual health, communities should also be educated on the effects HIV has on their community, both emotionally and economically. Those communities with high levels of HIV tend to be impoverished due to the amount of funding for that area going to the cost of medical supplies. Also, people with AIDS tend to have less of an ability to contribute to the workforce. This creates a lower socioeconomic status for the community. Providing free condoms and health care in a community can help reduce the number of those individuals who contract HIV. Educating the population and controlling the spread of HIV can help prevent death.